Good afternoon, everyone. Good afternoon. Great to be with all of you. My first time at the Paris Peace Forum, and the energy, the enthusiasm here is impressive. I know you're all here not just to see me and our other panelists, but this person sitting next to me, I'll introduce in just a moment. I'm Raj Kumar. I'm the president and editor-in-chief of DevX. And as any journalist, I'm always looking for what is the headline? What is the story we're all missing? And I think the big one, as we head into the COP in Dubai in just a few weeks, is climate and health. And actually, the news story today is that we have Prime Minister Mia Mottley here, who is in high demand and can be anywhere talking on any topic. But she is here to talk about climate and health. You know, I have spoken to many leaders and experts on climate issues at past COPs and events like this. And often they say the way that humanity will experience climate is through water. We'll either experience too little water or too much water. And of course, countries like Barbados, small island developing states, know this all too well. And probably the most iconic image we can all have is someone standing on the seashore, looking at their home and looking at the seashore and seeing it come higher and higher year after year. But I think there's a new image that will enter our minds. And I think this session today is meant to help cement that image. And that's that our human health is starting to shift. It's starting to change in pretty fundamental ways due to climate. Of course, water is one part, but what does it bring? It brings things like mosquitoes. We were just talking about dengue being in Europe and in the United States. We're seeing major shifts in waterborne diseases and in the effects of heat waves. And this is happening even now in 2023 at this stage, but of course the climate experts who are here in this room will tell you the trajectory is quite clear and the effects are going to get worse and we need to be prepared. And the question I think for leaders is, are we? Are we prepared? Do we have a plan? What are we doing from here? We're going to get into all of that today, but I want to first hand the stage to Barbados' best export, a country known for its beaches and its rum and many other great exports, but Prime Minister Mia Mottley is shaking up the world on these topics. It's such a pleasure and honor to have you here today.
Thank you, and I hate to correct you in my opening statement. Our best export, especially here in Paris, I think you will agree, is Rihanna. No, thank you for having us here. I mean, look, you're absolutely correct about the need to focus on the reality of what is happening. One of my criticisms about the last few years is that we spend so much time in events like this, at COP and other conferences, and what we're not seeing is the granularity that is necessary for implementation. If capacity is not there, commitments will mean nothing. And the reality is that we're going to start to see the consequences of failing to act in ways that you've just described. For us, the first 6 months of the year, our rainfall average was 50% of our 30-year rainfall average. In the last few months, we've had water like nothing. The ground is fully saturated, farmers are being affected. This morning, we heard from the president of Ghana the same thing. And in fact, they're also deeply worried about soil depletion. We talk about many things, but we haven't been talking about the quality of our soils. And the UN has reports that will show that in 20, 30 years, we're just going to see a significant decline in the yield of our agricultural produce purely because of the depletion of soils. And when you add to that now the consequences of what I have come to call the season of superlatives, the wettest, the driest, the hottest, the coldest, then you begin to understand that not only are you going to get direct consequences such as mosquitoes and other pathogens and other forms of disease coming from the global warming or from the change in temperatures in the ocean, but you're going to get also indirect consequences, such as a threat to food supply, and such as a threat to access to water, and such as a threat to where you are living, either because of coastal degradation or, as we've seen in Spain and other parts of the world, where the environment has just become completely inhospitable with respect to the capacity of people not just to live, but to earn a living. If there are farmers or other people dependent on agricultural communities, all of these people are affected. So this is really much more serious than the world is giving it credit for. Regrettably, we're being distracted with conflict after conflict after conflict, continent after continent after continent. And if we don't recognize, we're not going to win this battle with 30% of the world fighting or 40%. I made a joke with you just now and said, you know, the thing about mosquitoes is that they remind us that they're the smallest but deadliest insect on Earth. And similarly, small states, if they're left out of the equation, then, as we learned in the pandemic, the largest country is as vulnerable as the smallest state. Because once you allow that air bubble, once you allow that incursion, then all of us are affected. And if ever, it's almost as if the world, the planet, is playing a joke on us. We've taken too long to see people, hear people, and feel people. And the planet is telling us, well, you didn't see them, you didn't hear them, you didn't feel them, you're going to behave in a way as if you hadn't, because they're going to affect your ability, even as the strongest nation, to survive on this earth.
Can I just ask you one quick question, Prime Minister Motley? Please applaud. Prime Minister Mia Motley is here on this topic. I want to ask you, because you're at the center of these conversations with world leaders. Has climate and health, this nexus of climate and health, has it begun to penetrate the negotiations you're having as you think about development finance, the path forward for adaptation? Are people actually talking about this, or is this still on the fringes?
Look, it was in this building in June that we made the commitment for people and planet. And we made it because simply focusing on the agenda for climate would not be enough. And the reality is that the budget needed to fight climate is so all-consuming that it threatens the rest of our development agenda. Secondly, if you are asking me to borrow again as opposed to being able to receive grant funding, then you're saying that I should be responsible for something done by a third party in circumstances where my own development agenda is now going to be put on pause. We met in Paris 6 months ago to be able to say that's not good enough. And it is a false choice to ask us to choose between people and planet. We have to be able to walk and chew. We have to be able to do both. Now that means, therefore, revisiting all kinds of assumptions as to what is viable and what is not viable. And we have not gotten down to the granularity, as I said, which means that we probably are not strong enough on the consequences of the health crisis that is likely to emerge. I've been speaking, including here, on the silent, slow-motion pandemic of antimicrobial resistance. 100 years ago, women died. Priscilla, you were a gynecologist. Women died in childbirth or from infection from having children. Much more. Going to the dentist, you get an infection, you put your life at risk. We got antibiotics that helped us through that, and we made significant progress. We're back at a stage now where the effectiveness of the last set of antibiotics is shorter and shorter with each iteration of it. We had 23 companies researching new antibiotics in the year 2000. We're down to 4. 4. And if we study hard, everybody in this room knows somebody who has died because of an infection that has not been wrestled down because the antibiotics are ineffective. And we've seen it coming at us like a slow-motion train. But the economics of antibiotics doesn't work, because you take antibiotics for 7 days, 10 days. You take heart medication and diabetic medication, they want you to take it for life, so that it just doesn't work. We need to be able to understand that with new pathogens and with new infections and new viruses, if we don't get serious about doing the medical research that is critical to save people, we may well visit times that we thought we left in the Middle Ages, where large numbers of our population just die because of an inability to respond to them. And as I said, I'm not a doctor, you are, and you're far more equipped to speak on this than I am, but I am chairing the One Health Global Initiative, and we do now know that antimicrobial resistance is the third largest killer of human beings. And it's not just with respect to human health, but it is with respect also to plant health and also what we're giving our livestock, and then the impact that it has on our environment and our waterways comes back to water again. So these things are being discussed on a parallel track, but we now need to make the connections as is about to be done at COP28. And we need to equally, as President Ruto and President Macron will do with the International Task Force, recognize that the source of funding cannot only be the public purse, but the multinational corporations of the world have balance sheets that dwarf 3/4 of the world's countries. Now, if you accept that, and you accept that we don't want to bankrupt them, but we need to spread the burden and to allow everybody to put 2 cents, 3 cents, 5 cents out of the dollar, whether it is oil and gas, whether it is big pharma, whether it is big tech for the digital divide and the disruptive nature of artificial intelligence, whether it is the enabling companies of finance, insurance, and transport, without which nothing much can happen. We need to be able to step up to the plate before it is too late. You do not have the research being undertaken in sufficient, with a sufficient footprint now. And when you have the research find something, it takes a while for the regulatory process to approve drugs to come to market. So what we're asking for today, whether in terms of adaptation of our countries, whether in terms of research on pharmaceuticals, has a gestation period that is still 5, 7 years away from a solution coming to human beings. And that's what makes this conversation so exasperating, and that's what makes the need for political will so immediate.
One last question, because I know you need to get off stage. In 3 weeks, we'll be in Dubai. There is a day on health for the first time, a focus on health. What needs to come out of that COP day on health?
I think we have to agree on a blueprint that allows each country to take action. I made the point that you can't leave small states out, and very often small states don't have the fiscal space. It's one thing to even give them debt, but they don't have the fiscal space to take more debt. So you've got to change the understanding and the metrics in the international financial institutions that says that every dollar of debt is the same. A dollar of debt necessary to buy an immediate car for transport doesn't have the same value as a dollar of debt to build a school that will have an impact for 30, 40, 50 years. And we need to change from the world of instant gratification and short-term debt and high-interest money, and to recognize that we need to give the world a chance. I'll leave you with this, and I keep repeating it because I want the world to repeat it, to know that what we're asking for is not unusual. In the last century, Britain issued bonds in 1914 and in 1917 to fight World War I. After it went through World War I and had to fight the Spanish flu and to do all of the other things that were increasing the level of economic difficulty, in 1932 they said, look, we need to be able to refinance those 2 bonds because we can't afford to rebuild Britain while paying for the debt of World War I. They went back to the market, and they got a perpetual bond effectively that they only paid off in the year 2014, 100 years after the first issuance. When the pandemic broke, little Barbados said, we need to take all of the pandemic debt and stretch it out over 50 to 70 years. And people laughed at me and laughed at the country and figured we were either too small and I know nothing about economics, which is true. I'm not an economist, don't want to be. But I am a woman of practical affairs who understands justice and equity and history. We then went to Germany, when Germany lost the war in World War II. And there was a pact among the European countries and the United States of America and the IFIs that effectively said, limit Germany's debt service to 3 to 4% of its exports. And Germany was given the breathing space and the policy space to rebuild and to become the industrial giant that it is today. Britain was given the chance to be able to do it. I can go worse. Britain gave the slave owners 20 million pounds in 1834 to compensate them for giving up property of human beings, and then gave them another 26 million pounds in free labor from 1834 to 1838. Do you know when Britain repaid the debt? This century. If we can give Britain and Germany 100 years or special circumstances capped as a percentage of exports to meet the most critical challenges that they met in the last century and the century before, can we not do it in this 21st century when we have the benefit of history and precedent? And when we know that the justice of the case means that if you ask us to borrow to be able to do our own adaptation, it is a case of double jeopardy, because it was the blood, sweat, and tears of our people that led to the financing of the Industrial Revolution. And now that the Industrial Revolution has brought the world to the brink, you're asking us to go and borrow money again, when in truth and in fact, we know that if it was private law, tort, they would have to pay us. And if it was being faithful to the polluter pays principle, they'd have to pay us. You don't want to pay? Okay, at least give us the opportunity for longer term debt and lower interest rates so that we can meet the needs of immediate upliftment of our people along with the needs of saving the planet, and we can preserve the state and stability of our democracy, because you know here in Paris, if you don't deal with the people, what did Marie Antoinette say when she was rebuffed? We can't tell them let them eat cake. We have to meet the needs of our citizens. And perhaps what we're seeing with all of these conflicts is that this is the first time it's being televised in living color day by day by day. We've seen war before. We've seen genocide before. But when we've seen it in newspapers and photographs. We don't see it in living color in real time.
You mentioned, Prime Minister Mia Mottley, World War I. You mentioned World War II. This does feel like we are at a turning point in history, and we're looking down into that chasm. And it's events like the Paris Peace Forum and its leaders like Prime Minister Mia Mottley that give us a chance to imagine building a bridge over that chasm. So please join me in thanking.
Well, let me just say this. That I am hopeful, as I said this morning, that peace will come. And I am hopeful and optimistic that the planet will be saved. The problem is, what is our appetite for doing it quickly? Because if we don't do it quickly, the question will be, how many more will lose their lives and their property and their future and their civilization before we correct it? Thank you.
Thank you so much. Please join me in thanking Prime Minister Mia Mottley. We are going to continue this conversation about health and climate, so stay where you are with a panel of experts who are going to take us through some of the key changes that are happening in the world today on this topic. I want to mention that we have the Minister of State for Development, Francophonie, and International Partnerships for France, Chrysola Zakharopoulou, with us. Minister, such an honor to have you here. We also have Vanina Laurent-Ledru, who's the Director General of Foundation S, with us, and Omnia El Omrani, who is the Youth Envoy for COP27. And I call you a climate doctor, if we can start with you, Omnia, because you are maybe the first generation of climate doctors, and such a profession hasn't existed in the past, but you're a trained medical professional, and now you're a leading advocate on this climate and health nexus. Maybe just to begin for people, how did you start working on this issue?
Yeah, thank you so much for having me. So I have a small story to tell. I started working on climate change and health when I was a fourth-year medical student. I was 21, and I was selected to do an emergency medicine observership in Hialeah Hospital in Florida. During my second week on my way to the hospital, I received an emergency notice to evacuate my apartment because there's Hurricane Irma. I was among the 7 million residents that had to evacuate because of a Category 4 hurricane, which back then was an emergency. And I had the hospital to go back to, and it made me realize for the first time how climate change affected directly the health of our patients, both their physical health as well as their mental well-being. Patients came to us presenting with cuts, fractures, and injuries related to the hurricane. Patients, especially older patients, came with exacerbations of existing heart conditions, lung conditions because of the stress and the anxiety induced by the hurricane. And even after the hurricane, we saw outbreaks of infectious diseases, respiratory illnesses because of the crowded shelters and the compromised water sanitation systems. But what we also saw and what we heard, that so many other patients couldn't even make it to get the medical healthcare service that they needed, nor the medication that they needed because of the power outages, as well as the damages caused by the hurricane. When I came back to Egypt, it hit me how directly climate change is affecting health. And then when I started my residency, not a single day passed throughout the 2 years of my residency without a patient presenting with either an asthma exacerbation, an acute lung infection because of the high levels of air pollution, but at the same time, so many children and young people presenting with malnutrition. And you can see how it's not just a climate-related disaster, it's also the chronic impacts of how climate change is affecting the basic access to food, water, healthcare services, education, among other things. And this made me in 2018 be very curious, and I went to my very first COP in Katowice. And the reason why I went, because A, I saw how the climate crisis is a health crisis. B, I felt that it is my responsibility, not just towards my patients, but towards the environment which the health of my patients depend on. And then 2 years later, I had the opportunity to be appointed by the COP27 presidency as the youth envoy, which gave me the chance to not only work on intergenerational equity and integrating youth perspectives, but also to bring in health. And that is why, together with the presidency in the COP outcome decision adopted by 190 plus countries, we have the right to a safe, clean, and healthy environment integrated in the text. And now we have a health day, which is incredible. But it took us 28 years for a presidency to recognize that health is an important thematic day, and this needs to change now.
And let's talk about how that can change. And maybe I can bring Minister Zacharopoulou into this, because you are also a medical doctor. And in fact, you have some real experience about taking issues that are highly impactful, but not center stage, and making them center stage. You have had a big focus in your career as a gynecologist on endometriosis, which has been kind of a silent disease in so many ways until leaders like yourself put it in the center and put the women who are suffering from it in the center of the conversation. And now it's really changing the dynamic. And I feel like climate and health perhaps is a similar story. And as you enter the multilateral negotiations in the COP28, as you talk to your counterparts in other governments, what is the conversation like? We heard a little bit from Mia Motley about this, but it feels as though, as Omni is saying, it's still quite early in the climate and health discussion. We're still raising awareness of what this even is and what it means. Where does it stand now? What is the potential for real progress in the multilateral community?
Thank you. Merci beaucoup. A little bit in French, a little bit in English. I will start speaking French, as I'm Minister of Francophonie also.
It's true, and I'd like to thank you very much. It is true, and I'd like to thank you very much.
Not alone.
That is true. That I'm very proud because I exactly did what you did. There was a disease, a taboo. We were speaking about menstruation, painful menstruation, and the consequences on women's health and quality of life. And it's absolutely understood what you have to do. That's why I'm here in politics now. That means that you have to motivate and coordinate all the powers, the politician, the private sector, the research, and this what happened here. That's why we had a campaign and a program regarding endometriosis. But it was, as Mia said, collective work. This is what we're trying to do today regarding health. I was with the Sultan maybe 10 months ago when I told to him, what about the health and climate? Because during the COVID, I was in the European Parliament, a member of the European Parliament, and I understood that we speak about health only during an emergency case. The word prevention is not part of our life. That what we discovered in 2020, that many countries, they don't respect the investment on health, is like the education, the human development. We speak about money and investments, but not about the human development. And for me, it's the best investment. Because also, what I saw, we understood that we don't have health systems in many countries, and the other countries, they didn't have a resilient health system. We saw that, for example, in the African continent, only 1% of the vaccines, of the production of vaccine was in this continent. So we discovered how many things we have lost. We didn't take care. And I totally agree with you when you speak about the consequences of climate change, for example, air pollution and asthma. We see it more and more. Mia spoke about the quality of soils, and what will be the impact on nutrition, on health nutrition. I think that we can also say that the studies, allow me to make the scientific, estimate that between 2030 and 2050, climate change will cause 250,000 more deaths for malnutrition, malaria, and temperature shocks. Because it is true also, when we have the high temperatures or low temperatures, we have many deaths. So what we do, you ask me? I think that, first of all, I'd like to thank La Fondation S for what they do. And Anita, personally, who works, we work together, and we have to start to speak about this link, health and climate change. Secondly, if we speak about the policy, we have to put together the ministers of health, the Minister of Environment, and the Minister of Finance, because we have to work together. And of course, we have to invest on research, because the climate change, we study about climate change, but we have to study also with a focus on the consequences on disease. We know that we have many emerging infection diseases that can expand everywhere because of climate change.
Including fungi, right? There's a big new potential risk of fungus infections.
Exactly. So this is something that we have to do all together. That's why France, for example, we are a key actor regarding the World Health, and we participate. We have a strategy, on World Health. You know that we work, all of us, on an international treaty regarding the preparation of the pandemics. The World Bank created a new fund for research on pandemics, and we support. And I think that this one approach, one health approach, has to be taught to the Faculty of Medicine, but also we have to teach to the children, and we have to start to speak with the journalists. What is this one health approach that is simple, that if you have a climate change, it can change the health of people, but also of animals, and you see a cycle that a disease can be transmitted.
Speaking of journalists, if you want to know more on this topic, look at DevX. We have a whole series called Planet Health, where we have gone deep. If you really want to nerd out on this topic, we have that information. Vanina, let me come to you. First of all, thank you, Fundación S, for co-hosting this event. I think you've been doing a great job lifting up this issue and putting it on stages like this with people like the Minister and Prime Minister Motley. It's a really important topic. But where do we go from here with the topic? How do we turn it into something actionable? Because I know that's where your heart is. You've been working on field-based adaptation. How does this look as the world confronts the climate and health nexus?
Thank you. Thank you so much, Raj, for the question. Before answering, I'd like to thank Prime Minister Motley, Minister Zakharopoulou, Omnia here, because it is only through a coalition of the willing that you can actually move to implementation. So I think those voices matter so much, and it is actually very important that we're all going to be meeting at the Health Day at COP, and that's going to be a critical milestone. Now, in not too a distant future, I think that some of us might actually get a climate change diagnosis here in this room. As one doctor in British Columbia, not too long ago, did when he was diagnosing some of his patients that were suffering from the heat wave exhaustion, with so many symptoms that were linked to the very nature of climate change. That's what might happen very soon. So that is the future that we are collectively preparing for.
I've talked to some other executives in the pharmaceutical industry who say a lot of the way those heat waves will affect people is through their cardiovascular health, and that people may need to start taking preventative cardiovascular medication in the millions around the world as they are more and more subjected to heat waves.
But I'd like to think not only about those living in the north, but we also need to think about the people that have suffered from the massive floods that hit Pakistan, Malawi, and so many countries. And so there's not a one-size-fits-all solution, unfortunately. I think what we're trying to do at Foundation S is really to create healthier futures for generations to come. So what it means is that through the power of philanthropy, we can actually work with funding locally led adaptation solution. And why am I talking about adaptation? I'm talking about adaptation because all of the people in this room today, they've done a great job, notably with the June Paris Summit, to put the topic of climate financing on the table. But what we're seeing is that only 5% of the climate multilateral funding today goes to adaptation. And out of this 5%, only 1% goes to health, 1%. This 1% in total, it represents $11 billion, which one might think that it's a lot. But consider this. $11 billion is actually, the people in the US spend 4 times more that in digital entertainment alone every year. That's just to give you a comparison in terms of what we're talking about for the financing flows. So in front of this reality, Foundation S convened together with the Africa-Europe Foundation, a think tank, because Foundation S is structured as a think and do tank, and we very much believe in the power of thinking and doing. And this think tank has been working during 1 year and advised us and others that it was high time to fund adaptation. Okay, great. But they did so in the form of a report, which I encourage everybody to read afterwards. And the report basically says, you cannot fund adaptation unless you fund locally led initiatives. And it gives plenty of examples. So out of this report, we have announced that we are putting 42 million euros on the table till 2030 to really kickstart a number of concrete, small scale sometimes, bigger scale when we can partner with others to have a leverage effect, but fund programs at local level.
And why is that? Why is it so important that it can't work unless it's locally led?
Exactly. I mean, communities know best. We have been thinking that if you just repackage some of the old development work, it's going to work. Yeah. It's not. you need to really think with a climate lens and ensure you can increase the health resilience at your local level. And for that, it's not us sitting here in Paris in this beautiful Palais Brongniart that are going to think like a woman in Somalia who has to go 4 times a day to a well just to get the water she needs to feed her children and cook. It's impossible. So you cannot pretend you're walking in the shoes of local communities unless you actually entrust them with the capacity to implement those programs.
I'll share a quick example that I know I've told you already, which is in northern India in farming communities. One scholar was telling me that they saw the heat waves coming and the temperature rise, and they thought, well, people will adapt. Farmers will adapt by drinking more water. And that should work. But they noticed a big difference between men and women in terms of the outcome. And why is it? Well, there weren't bathroom facilities. And so the women, instead of drinking the extra amount of water, said, we can't do that, we have nowhere to go. And so they saw worse health effects. And this is to your point about you need a locally driven approach, because perhaps in Paris or in Washington, D.C., where I live, we would design this on a whiteboard in a conference room and make a big mistake.
Yeah. And I think it's very important as well to ensure that you, again, try to empower those communities at local level, but in doing so, you do not create pilot after pilot, because I think we all suffer from pilot sickness, if I may say. And it's very important that we quickly scale up those initiatives. So that's where working in public-private partnerships, working across silos, working with a One Health approach is so critical. So to conclude, if I think about a project, we've just funded 26 initiatives this year. A project that really called my attention was one in Chad, where there were no floods before. But now, Lake Chad, the communities living near Lake Chad are seeing the river rises up to 8 meters every 3-4 months, and everything gets wiped away, including health records, including the drugs that are stored on the floor. So that is what we're talking about. We cannot let those people reinvent their lives every 3 or 4 months, because it's creating a massive chain of unintended consequences, security issues, nutrition, and so many others. So we are really making a call to have everybody join us, join the power of public-private partnerships to ensure that we can accelerate the financing for those locally led adaptation programs.
I want to bring Omnia back in the discussion on the question of mental health, because there is a nexus between climate and mental health that hasn't got a lot of attention. Can you talk about what is that nexus?
Yeah, absolutely. So when it comes to the impacts of climate change on mental health, what we've seen and what I want to share is not just the numbers, but also the lived experience stories of people who are living with mental health challenges that is induced by climate change. So we heard, and we just finished a dialogue 2 days ago where we had over 80 smallholder farmers sharing their feelings of depression and suicide because of crop failure happening year after year. We also heard stories from women who are experiencing increased gender-based violence as well as domestic violence because of the scarcity of resources as well as the increasing temperature. And I heard that in person during Africa Climate Week from women in the Maasai community speaking on their behalf of the women in their region. We also see that people who are living with mental health conditions, particularly schizophrenia or depression, are 2 to 3 times more likely to die during a heat wave. And by 2050, 86% of the entire world is going to be exposed to extreme heat. And heat has the impact of people who are taking psychoactive medication, they impair the body's ability to adapt to the changing temperature. And this is why it can lead up to their death if it's not diagnosed in time. Which also brings into the important point that Her Excellency made around education, around training healthcare workers. As a medical student previously myself, we did a global survey where we looked at the medical curriculum of 2,817 medical schools across 112 countries. We asked one question: is climate change or environmental health mentioned in your curriculum? 85%. 85% had no mention of climate change in their education. And this means that 85% of doctors and the health professionals are not trained to be the first-line responders to the impacts of climate change on the health of our communities and people. And to go back to mental health, children and young people in particular are feeling the distress the most, not only because of them seeing how disproportionately they are being affected by climate change, but also the disconnect, the distrust between young climate leaders and their governments and the lethargic responses that their governments are making. And that is why it's amazing to have, and it's very important to have health at the center of global climate decision making, because it brings countries together to overcome their differences and to understand that when they come to COP, they are negotiating the health of their children, their young people. And they need to do that in a way that our health is protected, both our physical as well as our mental health, the community's resilience. And if I want to make another argument other than the intergenerational justice argument, if we talk even from a financial lens, if we invest in mental health care services, in climate-related responses, we can save up to 47 billion US dollars annually by 2030. And if we make it to 2050, we can save up to 537 billion US dollars. So investing in psychological resilience of people not only can improve the overall health of our communities, but it can also bring us the healthcare costs that is necessary to improve health across our healthcare systems to both be resilient, but also environment friendly as the first line responders to the impacts of climate change.
As I say, you are really part of that. Please applaud Omnia, please. My guess is many of you have not met a climate doctor, as I have just coined her, but I think you really are that first generation of climate doctors. And I think people who are going through their medical training, exactly as you say, will need to be attuned to these facts if they want to treat patients where they are and in the conditions they find them, right? I just want to come back to Minister Zacharopoulou, if I could, as we start to close down the session, thinking about the architecture of global development. I mean, you know it well because this is your portfolio, so you know that the world is filled with acronyms. There's always a new fund being created at the World Bank or elsewhere. There are the bilateral agencies. There's so many different initiatives. We now have a loss and damage fund. That's right. We now have a loss and damage fund created, not yet funded, but created out of the COP. When you think about this issue, how can we make climate and health cut across all of the various acronyms that exist, the funds, the agencies, or do we need a new agency? Do we need to change the architecture? How would you imagine we should approach this question?
This is the most difficult question, not only regarding development and health. This is the problem of how the development world is organized. So many funds, so many organizations, but at the end of the story, when I go on the ground, people, they don't see the evolution. This is very hard for me because, you know, as like a surgeon or like a doctor, I take a patient, I treat, and after, you know, I give a result, and I make the follow-up. Here we have a problem that, as you said, Vanina said, we don't decide in Paris, in New York, in Washington, or Geneva, how we are going to build the health systems. And you see that the question is not only money. No. The most important thing that we forget to speak about is who is responsible for the training of doctors and of all the of nurses. We don't have, you know, very well that there are the buildings, we can construct a building, but who will make it run? This is a big issue that we underestimate. So what we have to do, I think that when we speak about climate change, it's not only the hurricanes or maybe the droughts. We have to see that the climate change impacts every part of our lives. And this is, you know, a new vision of the world. Before, when we were speaking about climate change, there are the people that were like ecologists. The other, they were telling, is not my problem. But now it is a reality. So we have to work with WHO, of course, the World Health Organization, and it has to be part of, it has to be around the table in all this discussion. You know, it is part of our life, the health. And just to finish, I'd like to say that when I did a master on health management, I said, but why we don't invest on prevention all around the world? Because they told me, you know, Chris, politically, when you invest to the prevention, you don't see the results. So we treat always this emergency. So what we try to do with my government in France, but all around, is just to prevent. And we have to think about how we can prevent and the consequences. So we invest, it's better to invest on that treat always during the emergencies, because, you know, spend your money for the emergencies cannot resolve the problem.
That's a great point. And Vanina, maybe you can close out our session on that point. Because the way our health and humanitarian budgets are constructed, you mentioned silos earlier.
Yes.
So much of it is around emergencies, and for good reason. There are many emergencies, more than ever, happening now. Go ahead,
If I can
Chris.
say, you see that we speak about humanitarian end, and more are more. For me, if we speak about humanitarian end all the time, that something's going wrong, that the problem is there and you treat only superficially. That's why in Paris, 6 months ago, we came and we say that we cannot treat only what we see. We have to go to see the cause, and we have to work together to treat the true cause. If not, yes, we have to find money all the time for the humanitarian aid. Today is this, you see, in Israel or Palestine, what is happening with the people. So tomorrow will be in Sahel or another part of the world. But this is not the solution.
And you can see it in the budgets of countries like France and the US and the UK and Germany and others. A much higher percentage of their bilateral aid is now going to deal with emergencies, which means there's much less available for long-term development or exactly the kinds of things you're talking about, Vanina, strengthening health systems and making them more resilient.
And I'd like to react here because, as we have abundantly heard, climate change threatens the very fabric of our societies. And that's what we're talking about here. So we cannot wait for the perfect program. We cannot wait for the perfect design of the fund or the perfect design of a climate and health strategy to act. And really, I'd like to conclude with a call to action to ensure that we can unleash financing for those community-led adaptation programs to increase their health resilience now, because time to adapt is now. We don't have any other time to wait. And at the end of the day, it's really important to remember that every dollar invested in health yields 2 to 4 times that. So what better investment can you imagine?
I think it's a great point on which to end. And I'll just say, you heard this from Chris, from Minister Zakharopoulou, and from others. Human health is the way many of us are now going to experience this change in climate. There was a time when people even denied the climate was changing. Now we know it's changing, but we are going to start to experience it in our everyday health for all of us, wherever you live in the world. And I think that ought to change the political conversation that happens, and ideally the funding change that happens, and we're at the start of it. And it's people like Prime Minister Mia Mottley, it's people like Minister Zakharopoulou who are driving this agenda. So I want to thank this group, and I want you to join me in thanking this fantastic panel for bringing this to the Paris Peace Forum stage. Thank you.